Here, screen record Carlos answering a question.
Oh, you just had it all over it.
Sorry about that.
My whole face.
Carlos.
Yes, Professor Stanley.
How are you?
I'm good. Yourself?
I'm doing very well. You have. How many clients should I give Carlos? I'm gonna give you 4. Show the world. Clients. Carlos has 4 clients.
Patients or clients?
Both. Same enchilada. It depends on where you are, business management,
what hospital you work at.
what hospital you work with. Okay. Of these 4 clients, which client is or patient is your priority patient, and why? Shame me not.
Falling can be real shame. The one at risk for falling isn't really priority because if they're laying down, then they'd be good. Open sacral wound, saturation ANC should be fine. Oxygen mask. Really between the open sacral wound, O2 is at 92%. So, question: this is a patient or client number 4. That's all.
Let me hear you. Let me hear what your question is. Is the what?
I was about to say is COPD patient on a high oxygen mask or
That's what y'all love to do to me on these exams. If it's not an issue on the question or the scenario to provide to you, it's not an issue when you choose your answer. Hurry up and tell me who's your priority patient right now.
Then I'll go with number 4. Try to get that O2 up to 95 or above as fast as possible.
This is your priority?
No,
You say no?
no,
No.
because he's at 92, and it's anything under 90, then that's your priority.
She just said normal range is 95. They also
Yeah,
have
normal range,
COPD
but
already, so.
Yeah, but on
Actually-
a test,
And
it's
TikTok,
under 90.
they don't know. I didn't teach them COPD yet, but I just felt like doing this to them right now. So I'm going to extend some grace right now. Okay. Carlos, your priority patient
It's Airway.
is okay. All right.
I agree.
Anyone disagree with Carlos with this being your priority patient? Should disagree.
I disagree.
You did.
Yeah.
Ooh, that's a hate, is it? Okay. First of all, let me see. I should rub my gavel if I was in this mood.
really only a problem.
Chanel, why you disagree? Why you hating on his response?
Because honestly, I think it probably the pain 10 out of 10 because it doesn't exactly specify. It could be chest pain. The patient could be having a heart attack.
Yeah.
Or the patient could be having testicular
She
pain.
just said it's not on the question. It don't matter.
I did say that. I did say keep it simple. You can't assume. You cannot assume. Okay.
But 10 out of 10 is going to raise his blood pressure. 10 out of 10 is going to put the patient into some type of, he's going to have other symptoms other than just pain 10 out of 10.
Okay, so Chanel says,
But how do you know it's a real 10 out of 10?
oh!
I could get a paper cut and say I have a 10 out of 10 pain.
Yeah, your pain and my pain are different pains.
Okay. All right. Okay. Trinity, what says thou?
Maybe,
Number 2.
You say 2?
Yes.
Open
Oh, why?
it can get an infection.
Hold on. Let me hear why Trinity says 2 is the priority.
It's near the butt, so like infection.
Okay, because of infection.
Didn't that count as circulation too?
Uh-huh.
No, but it's like
It could be a pressure wound though too.
Huh? All you got in this is an open sacral wound. Okay. Anyone agree with Trinity that 2 is your priority patient to deal with right now?
Nope.
Yeah. Nope. 2. 2. Okay. All right.
She right.
Okay. 2 people.
No, but-
How many agree with? First of all, Carlos, that this is your priority patient. 1, 2, and ask TikTok what they think. Who they think is the priority? 1, 2.
They're saying 1.
They're saying 1 at risk for falling. Okay, TikTok. Okay, I'm gonna say TikTok said. TikTok said 1 is the priority. Okay, all right, okay.
Turn the comments
Well, now they're saying 3.
Now they saying 3. Oh, TikTok, I'm gonna need for y'all to make up your mind over
What's
here.
your wrong on the thing? We could just say TikTok said.
No. Okay. And how many agree with Chanel that 3 is the priority client right now? No, nobody. So
I'm
you
between
standing
2
on
and
this on your by yourself. You
I
are
guess so.
you on this island by yourself. Okay. Oh, Bree. We got 4 clients. Hurry up. Look at these 4 clients. And these are Carlos's clients.
Carlos and Bree.
I need you to think. Tell me who is the priority client. TikTok says 1. Okay. And then but Carlos says this is his priority patient, and I need you to tell me if it's true or not. And y'all will be very interested to know who's going to be right or wrong. What says
It's
that?
definitely not 4.
You say 4? Okay.
2.
And you say? 2. You say 2. Open sacral wound.
Yeah.
All right. What? Who asked what COPD is? When I presented that in some way, shape, or form, like either week 1 or 2, or last week, I don't know. What does COPD stand for, people?
Chronic obstructive pulmonary disease.
I think it's keywords chronic.
Was this
Is that a
chronic?
Yeah, chronic is it's not 4.
And I talked to y'all about this last week.
But number 4, you can literally just stick an oxygen mask on us.
Okay.
Don't say that. Now, when you are prioritizing care people, you need to know what is expected of these diseases versus what is not expected of these diseases.
Well, that's what I'm saying. Someone that has COPD is going to have a lower oxygen level.
Yeah.
And that is why you standing on the right island on yourself,
She's cooking.
that pain. But Chanel, please don't add. Okay, stop being correct. No, I can't say stop being correct. Keep it simple. Okay?
I'm overthinking.
All right? Guys, this is your priority patient simply because they are currently in pain right now. 10 out of 10. Okay? Yes, airway, breathing, and circulation. That is true, like we said, the physiologic. However, this client's physiologic needs are met because this is expected for them. This O2 SAP. COPDers, and you'll learn this when we get to respiratory. COPDers we're happy when they're, I think your book says either 88% or 89. I can't remember. Don't quote me because your fundamentals book said one thing, and then when you get to med-surg, your med-surg book says something else. Okay, just go with the flow for that semester, all right? Now, and some books actually say 90%. You understand? Y'all start asking, what if they got an infection? Even if they're at risk for infection, all they said is this an open sacral wound. That's all the information you have. That is all you're working with when they ask you questions like, which patient should the nurse see first? Or who should the nurse delegate this assignment to? Okay. Know what's expected versus what's not. Look at Alexandra like, oh, you tricked me. You tricked me.
Nah, these questions are like, the whole thing is so contradictory because you're like critical think, and then you're like,
It's
don't
not,
overthink it.
there's not critical thinking. Now, remember we said, what is your priority? Physiologic needs. This is a physiologic need because when your pain is elevated like that, 10 out of 10, yeah, they didn't say where's the pain, what the source of the pain is. Is it a paper cut or remember, pain is always what the patient says. I don't care if it was just a little nail tear, okay? If they say it's 10 out of 10, you always believe the patient in the U.S. of NCLEX. Okay, now, we keep it like this is a physiologic. Now, this open sacral wound, yes, they're at risk for infection. When a patient, first of all, let me go back to, remember when I said, I didn't say. When it comes to acute versus chronic, that's 1. At risk for, they're no longer your priority. They don't have the issue. Your priority is always the actual versus the potential in terms of prioritization. If they said something like, what if they said something like, because you can't see this, at risk for respiratory issues, okay? It's at risk versus somebody who actually has the issue. Does that make sense? That becomes your priority, okay? This patient also is not, if I change this and I said COPD with an O2 stat of 72, yeah, you be cooking. Forget this pain. Okay, 72. Then, because the physiologic need is no longer being met. Also, even if I said this patient has an open sacral wound with a with MRSA, okay, where does this fall? Under physiologic, or does it fall under? Where does it fall under the Maslow's hierarchy of needs in terms of safety? You see that? It falls under safety. So even if I put a bug in this, a pathogen, that ain't your priority over these two. Does that make sense? You see how these questions? Yes.
So then how would you rule out if in my head it's saying ABCs and then you're talking about physiological, how would you rule out the ABCs versus the physiological? Which one will be my priority in that? If I'm looking at airway, breathing, circulation, and then we have now physiological is the next step. How would I determine?
No, physiologic is always your priority.
Versus the ABCs?
No, the ABC isn't your physiologic. It is the very basic physiologic need that must be met always. Y'all didn't mention it, but oxygen is also a physiologic need in the book. It'll tell you that. Okay, oxygen. So if airway, breathing, and circulation is not an issue, but yet there's other physiologic needs that's not met in this, then yeah, I'm dealing with the physiologic. Okay. Again, but when we advance more in this term and throughout the program, you'll notice you have to know what is expected versus what's not expected
so
for each.
The COPD, since the optimal thing was the actual oxygen saturation.
At
so
92.
Once you know about it,
yes.
You can differentiate if it's an actual priority versus not actual priority.
Yes. Okay. Cornelius, you had your hand raised. Okay. All right. That wasn't lecture, but I felt like throwing that at y'all. You know, prioritization. We're going to do more and more of these.